I grew up in Geelong and I did my bachelor degree in pharmacy at RMIT University in Melbourne, and I did my internship at Benalla Health. Benalla Health has just an acute ward, about 20 beds, but as an internship position it offers so much more than that. You get to go see other clinical services like DNS, podiatry, so we got to see what other allied health professionals do.
So at Benalla I'm really enjoying the environment. So the more rural environment, it's quite relaxed while getting to look more in depth into the patient conditions, looking at MMPs, admissions. You get time to really focus on the patients and have a chat to them and get to know them. It's nice and close to everything else around. Wangaratta's only 20 minutes, surrounding towns are all very close, and it's just a very nice town as well. In Benalla I look after the maternity ward in addition to being in the acute ward. And then I have rotations at North East Health as well. So the education component is really good. Each week we have intern-led tutorials and then the clinical tutorials with the pharmacists each week. And they're very beneficial. The pharmacists have a big wide range of information. They're very experienced and it's really great to learn from.
So I grew up in a small town outside of Shepparton, and then I moved to the city to study pharmacy at RMIT Bundoora. And then I decided to move back to the country, close to my family, to be back at Benalla Health, where I did my internship for the full year. So I definitely think that my favourite part about Benalla was having such a small team. When I first started, we had one pharmacist, we moved to 2 pharmacists and we had 2 technicians. So we had a really close-knit unit where we were working really well together. It sort of gave me the opportunity to be independent in areas where I didn't think I would be able to, so early in my internship, but also gave me support of having a closer team where you could sort of just be like, oh my God, help if you really needed it.
As a Benalla intern, every day is different because you're experiencing time at both Benalla and then Wangaratta. So you're getting to see different workplaces and how they run differently as well.
For your internship, it's a very good work and lifestyle balance. There's beautiful surrounding places to look at on your weekends, but you're also at Benalla, got a small team that you can work quite independently and grow those skills, but at Wangaratta you also have a supportive team where you can experience more patients and you have your own patient load quite early on. What advice I would have for a student contemplating doing the internship at Benalla or Wangaratta is put that name down.
Hi, I'm David Ford. I'm the Director of Pharmacy here at North East Health in Wangaratta. If you're a undergraduate student considering a rural placement or wanting to do your internship in the country, please consider coming up to North East Health in Wangaratta and Benalla Health. We have a fantastic program up here. It is a very structured, very clear program for our interns. We provide you a patient load very early on in your internship to give you some responsibility and teach you various skills that you'll need as a pharmacist. And also our education program, which is very, very structured, both from a clinical perspective and an over-the-counter perspective. Please come and talk to our current interns or our past interns about their experience up here. But if you're considering a rural placement, I urge you to consider coming up to Wangaratta and Benalla. It'll be the best decision you ever made.